problem with your joint pain, for example, damage the joint, and then you start taking ibuprofen, and ibuprofen is blocking the inflammatory mediator that's required for that joint to heal. And so people are often doing this. They get arthritis in their knees, and so they start taking these like daily, and they're inhibiting and they're blocking their knees from repairing, so they end up with a knee replacement later on, 10 years down the road. Well, they're also increasing the risk of heart disease.
Hello, everyone. Welcome to the Healthy Heart webinar. Today, we are here with Cheryl and Dr. Saunders and myself, Leslie. We're excited that you guys are on. We're going to talk about some interesting things today. The risks associated with using pain relievers and then the effect that has on your heart. And so, I feel like I've heard some good things about Baby Aspirin and the heart, but I don't even know if that's true. And I don't know what all the risks are. So I'm excited to learn from Dr. Saunders today. If you guys are on our webinar yesterday, you'll know that Dr. Saunders isn't actually at home. It was so funny. We had someone who said, wow, Dr. Saunders has a nice house. He had this whole background. It was absolutely beautiful, but it looks like you're still at your conference, I'm assuming.
Yeah, still at the conference.
He's at a medical conference, but he's taking time out of learning to chat with us. So we're excited to have him here. Say hello when you guys hop on. If you're on Zoom, you can use the Q&A to ask questions. That's the best place for us to manage those. And then Facebook YouTubers, we're so glad you're here too. Feel free to comment below there. We'll do our best to get to those. Yeah, I think that's it. So welcome. I think we're on maybe episode, I should have checked. Let's just say 16 or 17 of these webinars. So if you're new, welcome. This is a pretty new webinar. We've been doing webinars. I think we've done 204 webinars about type 2 diabetes. And out of those webinars have come this big request from people who want to learn more about how to keep their heart healthy. And so we've created this webinar each week. This one's Thursday. Our type 2 webinar is on Wednesdays. And if you have no idea how you got here or what we're even talking about, you can go to bartonwebinar.com and you'll find out a lot of information. But these are free webinars, free opportunities for you to learn how to better your health, take better care of yourself, and maybe prevent some illnesses. And if you've already been diagnosed with an illness, we're going to talk about those things too, and what we can do about that. So one of the things I loved yesterday chatting with Dr. Saunders is that, he learned some things in medical school, of course. But Dr. Saunders, share with us why you've continued to dig into these things. Why can we not just say, oh, you're looking like you could have a heart attack, here's your prescription to help with that, or you're looking like your heart isn't super healthy, here's your drug. Why was that not okay for you? Why did you not settle for that?
Because the way we do things now is really based on marketing, right? So somebody came up with a drug that would lower cholesterol. So they said, oh, what could we use this for? Oh, look, there's cholesterol deposits in arteries. Maybe that would work. And so they started marketing it based on some really questionable research. And then over time, it's been found that that's not even an issue. It's a non-issue. And yet people are spending billions of dollars, that's billions with the B, on this thing that's either making them worse, like causing Alzheimer's disease and muscle problems and a lot of other health issues. So they're getting side effects from something that's not really even giving them any benefit. So the reason I look into these things is to say, okay, what's really working here? What is actually going to help somebody? And so in my office, what I do is I take people as individuals. This one individual has all these issues that are going on, and I look for things that they may not even know about. So yeah, I do test cholesterol, but you know what? I think if it wasn't for the current marketing program of Pfizer, I don't think I would even test for cholesterol, because there's other things that are more important. So for example, triglycerides, that's actually an important something that you should know. And so we talked about that, a list of tests that we do instead. So finding out what's really going to help, and not just giving people a drug just because that's what the company that sells the drug said we should do. That's why.
That's good. And we're thankful for that, which has also led us on this journey to create the Healthy Heart Solution Kit. And these are things that Dr. Saunders has been recommending to his patients in his office. And it's put together in this nice little book. You can get the downloadable version of this immediately. Or you can get this hard copy too. It just costs a little bit more. But if you want this right away, if you want the digital version, it's under $20. And so we'll talk about that. That's available at bartonwebinar.com. But we're going to dig into some of that information today. And then guys, ask questions in the Q&A. You want to know more about this, or if you want to know, you have a personal question on here about your heart health journey, we'd love to hopefully get to those and ask Dr. Saunders about that. So that's what these webinars are for, primarily for your questions and a little bit of teaching. So I also want to put a quick disclaimer out there. Dr. Saunders is not your doctor, so please discuss with your professional before you implement any of the things that we're talking about today. Not only because I have to say that, but also because everybody is a little bit different, and we don't have your, not me, but Dr. Saunders doesn't have your full health history in front of him to look at what's going on. Just like he kind of mentioned, everybody's got different things going on, and you really want to be able to dig in and see. So, all right, with that, let's go ahead and get started. So we have been talking about different risks that are out there that can impact the health of your heart. One of them, and Cheryl, actually, I'm going to have you hop on and chat about this part. Just you and said Dr. Saunders had written some articles or an article about this in Home Cures That Work. First of all, tell us about Home Cures That Work, and then maybe tell us what you found in that article, and we'll have Dr. Saunders explain some of those things.
So Home Cures That Work is a website that we offer for subscription, but also there are a ton of free articles. But if you do a subscription, you get a Dr. Saunders articles every month. Other health specialists also write. It's like a research tool. If you have a question about your health, go there and look for it. Or if you just love to learn, go there and look for any kind of question you have about health, whether it's product related, ingredient related. We have a ton of articles that explain why we chose berberine as a blood sugar support supplement. We have ones about turmeric, not just about our supplement, but a wide variety of articles on turmeric and why you'd want it. So when I learned that today's article or today's topic was about pain relievers, I thought, I think Dr. Saunders wrote an article. He's been doing this for over 15 years. So 15 times 12, I can't do the math in my head. That's how many articles you can get from Dr. Saunders. But I looked back and I don't remember what it is, but he did an article about better natural pain relief than ibuprofen. One of the things he talks about is ibuprofen, why there's a risk in taking it. Increased risk of heart attack, bleeding stomach ulcers, increased blood pressure, congestive heart failure, kidney failure, anemia, asthma, changes in color vision, meningitis, and infertility in men. And then he lists the ugly black box warning. So if you don't know, every drug comes with, not every drug, but they come with a black box warning, which tells you why you don't want to take this. And the one for ibuprofen says, non-sterile anti-inflammatory drug can cause an increased risk of serious cardiovascular thrombotic events, including myocardial infarction and stroke, which can be fatal. And then it goes on and it says it can be ibuprofen tablets is contraindicated in the setting of coronary artery bypass graft surgery. And there's more, but that's serious.
That's a lot.
Risk. If you're thinking about taking ibuprofen regularly, he talks in this article, he talks about why you don't want to take it for joint pain and how it actually makes things worse. So I think that's enough to get started. Let's get into the brain behind this article with Dr. Saunders and why ibuprofen might cause heart problems.
Okay, it's not just ibuprofen. Naproxen, which is also over the counter. And a lot of people are prescribed something called Celebrex. And Celebrex is one of those that has a black box warning and says, this can cause fatal heart attacks. So think about that. What would be the cause of that? Why would that happen? What these medications do is they block certain inflammatory mediators that are important for healing, and so this is kind of important. Also, they increase clotting. So there's really only one non-steroidal anti-inflammatory medication that does not increase your risk of heart attack. It's aspirin. And so some doctors or some cardiologists tell their patients, well, you should take an aspirin every day because that'll inhibit the clotting, slow down clotting. And people often attribute that same lack of risk or benefit to other non-steroidal anti-inflammatories like ibuprofen, but that's not the case at all. So these, they're COX-2 inhibitors, COX-1 and 2 inhibitors, and COX is cyclooxygenase. And these are really important inflammatory mediators that allow healing in the body. And that's how they inhibit healing. So what Cheryl was talking about, having a problem with your joint pain, for example, damage the joint, and then you start taking ibuprofen, and ibuprofen is blocking the inflammatory mediator that's required for that joint to heal. And so people are often doing this. They get arthritis in their knees, and so they start taking these like daily, and they're inhibiting and they're blocking their knees from repairing. So they end up with a knee replacement later on, 10 years down the road. Well, they're also increasing the risk of heart disease. And it's the same kind of process that's going on. Think about it this way. You have, remember, we talked about this before. In case you weren't here before, we talked about why heart disease happens, and it happens because of clotting. So when blood clots form in the arteries, then they get repaired very quickly. And if you have anything that blocks that repair mechanism, then you get more and more clotting that's forming inside the arteries themselves. Think about that, what has to flow through that artery. You've got blood flowing through there. And if you start closing it off and forming clot in there, then you limit the amount of blood that can get through that artery. Plus, if you can't repair it really quickly, you're not going to get the glycocalyx, which is that lining on the inside that makes it so slippery and makes the blood move so smoothly through your arteries. If you don't have the glycocalyx, then you get sticking of platelets and you start forming clots too. And that's part of what these anti-inflammatory drugs do. So it is super important that you are able to repair. So it's been shown that within even a week of taking non-steroidal anti-inflammatory drugs, you are already increasing your risk of heart attack, like damage to your heart, because of from day one, from the very first time you start taking it, you're already damaging the lining of your arteries or preventing the repair of that lining. So that's why it's important to take that into account. If you're taking a chronic non-steroidal anti-inflammatory drug, then then you should look to other things. So that begs the question, right? Then what can I do instead? What are my other options? There are things that actually decrease inflammation and decrease pain, and at the same time improve function of the arteries. And those would be something like turmeric. Turmeric, we actually sell turmeric BP, which BP is not Barton publishing. It's actually black pepper. And the black pepper associated with that turmeric helps it be absorbed like 22 times more absorption. So that's really important. So if you're getting a turmeric supplement and it's just pure turmeric and nothing else in it, then then you're missing most of the absorption, because it doesn't absorb very well into the body. So that's kind of important. There's another supplement that is long been used for thousands of years, and it is a frankincense, which we call Boswellia. It's from the Boswellia plant. And Boswellia has gone head to head with naproxen, comparing how well does naproxen work versus Boswellia. And it's just as good. It has none of the ill effects of Boswellia. It actually will improve the function of your arteries and improve the glycocalyx lining of the arteries and improve healing. So you actually improve healing rather than stop healing, block healing, which the naproxen does. So those are two anti-inflammatories that you can use for pain and for inflammation that will not damage your arteries.
Let me just ask that, Boswellia, someone's going to ask, how much of that should we take? And are there any side effects to that?
Everything has potential side effects. But as far as inflammation, this is something that decreases inflammation. And the only issues that I've found with it are if you use it constantly for long periods of time, its effectiveness declines over time. So it's one of those that you have to take it like 5 days on, 2 days off if you're going to take it long term. But if you're taking it short term for pain, like for an injury or something, and you want that to repair well, then you're taking it for a short period of time, then that's not going to be an issue. But the amount is 500 milligrams approximately, and that would be 3 times a day. So it's more consistent. It's not something that you could just take once a day. Its effect wears off.
Is that the same thing as frankincense? Like, can you use frankincense oil?
Yeah, frankincense is the resin from the Boswellia plant. So yes, frankincense has been used for years for healing and for inflammation. And you can use that. There's the oil, the essential oil that comes out of the Boswellia that they also call frankincense. And then they have, and people use that topically. You can actually take the oil, put it directly over a joint that hurts or a painful area or something like that, tendonitis, and it'll relieve that. Or you can use the resin, which actually they used to smoke a lot. You can put it in like a pipe, a bong, and use it. And then there's the extract, which is a alcohol extract or water extract of Boswellia.
Someone had asked, how do you get it? I think my supplement that I have is actually from Pure Encapsulation. I think so. You can probably find those. Is that what it's called? Is that the brand?
Yeah, the brand is Pure
Okay.
Encapsulations. That's a good brand. They test. I like them. I often recommend those because when the state of New York went into CVS pharmacy and some nutritional store, nationwide kind of stores, and they took stuff off the shelf and tested it and found that, especially with the herbs, a lot of them didn't have what they said they had in it, didn't have the amount that they said they had in it, so they said, you're really taking your life into your hands when you're going to a health food store to buy these supplements. So that's one of the reasons. Pure Encapsulation is a good one. They test before and after. Other ones you can get online are orthomolecular products is another one. Thorn, is a good one.
Okay.
I think Thorn you can only get through doctors though. And these are reputable companies that actually test before and after. They're not just throwing junk into a capsule and saying this is what it is.
And to be clear, we also test before and after our products as well.
Correct.
Yeah.
The company, the people that we use, wow, I went, I toured the facility,
Yeah.
and they had like our cinechroma. They said we can't make cinechroma, and we're like, oh no, we gotta have cinechroma. And we went into the lab and he showed us that they had gotten this huge batch of cinnamon from Southeast Asia, and it had been cut, which means they dilute it with talcum powder, and it's colored talcum powder, so you can't tell. It looks just like cinnamon, and they look under the microscope and they could see that there was talc in there. So they couldn't make it for us. They had to get in another shipment. So they test before so that they know that they're putting the actual thing that you want in there, and then they test afterward to make sure it has the right amount.
Wow. Roy said my PCP took me off my baby aspirin a day. Then following my hip replacement, the surgeon put me back on baby aspirin to prevent clots. When can I think about going back off the aspirin? It makes me more prone to bleed a lot with really small wounds. I would really like to get off aspirin if I can. I'm 7 weeks post-op. The surgeon's office is unresponsive to my question and request.
Okay, I'm not your doctor, remember, that's the first thing.
Yes.
But the aspirin is really reasonable for short term. It's not a problem, and probably doesn't inhibit healing the way the other NSAIDs do. At least I haven't seen any evidence of that. So it's okay to stay on it for a short period of time, but 4 weeks or 7 weeks, is that what he said? 7 weeks?
7.
Yeah, post-op. Yeah, that's fine. You only need to be on the aspirin during the time that you're immobile. Once you're mobile, up walking around and doing stuff, then the aspirin isn't necessary. It is superfluous, and you might as well get off of it. So I'll give you that's the outline of the principle behind it, so that you can decide if that's what's right for you.
Right. And Dr. Saunders always is saying it's okay for you to take your health into your own hands. I mean, it's okay to ask questions and find out what's best for you. And you can take that however you want to take it. But there's just a lot of things that I feel like we're being taught that aren't necessarily true for everyone. Sometimes I don't even know if they're really true at all, but that's beside the point. We'll keep going. Okay. We do have a question. This is actually diabetes related, but I'm going to ask this. Michael said confusion. When you start reading about diabetes, one says eat oatmeal in the morning. Another may say no, eat oatmeal. Who to believe, what to read, and what would you say to that?
Okay. The answer is always, it depends, because the point of view of the person who's saying eat oatmeal is saying oatmeal has really good fiber in it that helps you grow good bacteria in your intestines. It lowers inflammation. And that's something that can improve your insulin sensitivity for blood sugar, for example. And the one that's saying don't eat oatmeal says, well, oatmeal has a whole bunch of carbohydrates, and so it's going to raise your blood sugar. And so, yeah, the question is, which do you choose? And that's where we have in our diabetes solution kit. Get the diabetes solution kit, because we actually go through all of that stuff. We start you off on phase 1, where you're not going to eat oatmeal because there's just too much carbohydrate in it. And then, but when you're in phase 2, then you're going to try oatmeal, and you're going to see, does this raise my blood sugar significantly? Does it, is it not good for me? Because some people will tolerate it just fine, and some people will not, depending on other factors in their life, and how much insulin resistance they have, and how much genetic issues that they have. So there are so many issues that we can't make a program for every single person. So what we do is we make a program that is the detox. So once you've detoxed, then you individualize your program, and that may include oatmeal.
Yeah, awesome. And if you don't know what this is, you can find information at bartonwebinar.com. I would agree, though, there is so much conflicting information. We have people who hop on our webinars and they're like, this is like the opposite of what was told for me to do. And although I will say this is just one way, there have been other proven ways to reverse type 2. And Dr. Saunders mentions this, but this was just kind of like the easiest way, I feel like. And so many of you.
Yeah, it's terribly hard. It's terribly confusing. Especially, I had a guy in my office who'd had a heart attack. And so he's got a cardiologist. He goes to his cardiologist. Cardiologist says, do this and this and this. Then he comes to my office. I said, get off that. Stay on that one and do these other things. And he's like, I don't know what to choose. And I said, really just like pick a doctor and go with that. And like, think about it, say, okay, what do I want to accomplish? And then how am I going to get to that? Or who's going to help me get to what I want to accomplish? So I've had people who, I had a woman come in with diabetes who did not want to lose weight. And she was rather overweight. And I said, well, I can't help you. Go back to your doctor that's giving you the drugs that are causing you to gain weight. And so, okay. And she did. And so, it's not that there's one particular thing for everyone. It's what do you want to accomplish and who's going to help you get there?
Yeah. We had someone hop on who said, I've been on baby aspirin since my heart attack in March of 2022. That's a long time. Is that okay?
Been on what since 2022?
Baby aspirin.
Oh, baby aspirin. Well, it's okay. When statistics were done overall and looking at the big picture in population studies, what they found was that there will be more problems from the bleeding from the aspirin and from stomach ulcers and those kinds of things than the number of people who were helped by taking the aspirin for their heart. So the answer to your question is statistically, no, that's not really very, very good. But for you as an individual, if you have a clotting issue, for example, and that aspirin prevents you from clotting, that may be beneficial.
Why was baby aspirin created?
Okay, because a normal aspirin is 325 milligrams. And they found out that aspirin is a permanent inhibitor of cyclooxygenase in the platelets so that they don't stick. And since it permanently prevents the platelets from sticking, you don't need very much of it. You just need a tiny bit. In fact, the guy that found this out was won the Nobel Prize for this, was a professor of mine at UCLA. And he said, someday they're just going to have a lick, like a salt lick for horses. They're going to have an aspirin, like before you go out every day, you lick your aspirin and then you walk out, because it doesn't require a lot. So that's why they say the baby aspirin. Hopefully then you won't get problems with stomach ulcers and all that, but it still does.
Okay, I thought it was created for babies, and I was like, are we giving babies aspirin?
What about omegas? Would that be a better option?
Actually, yeah, Cheryl, that's really a great idea for both things that we're talking about today. One is for inflammation and pain. The anti-inflammatory effect of omega-3s is really helpful. And then the other thing that it helps is prevent clotting. So if you go off an aspirin and go on to omega-3s, you get double benefit and you relieve all of the risks. So yeah, Cheryl, that's a great idea.
How much omegas should people be taking in a day? What's your recommendation?
Okay, so for omega, I'm actually writing an article for Cheryl for Home Cures That Work on this right now.
What do you know?
And so I've been looking into this a lot. I've been like digging deep, and man, there's so much. Okay, you can't have too much omega. Well, you can get too much omega-3s. Balance is what's the key, because you need omega-6 and you need omega-9 and you need omega-3, and you can't make them. You can only modify them, and they have to be made by plants. And so the the fish, you know, you say, oh, fish make it. No, fish don't make it. Fish eat omega-3s from plankton and seaweed and algae. So ultimately, that's the algae oil. You know, you can get algae oil, omega-3. Well, that's what the fish eat. That's how they get their omega-3, and then they modify it, and then we eat the fish, and then we further modify that for our benefits. So how much is not an easy question for everybody, but it's generally around 1 gram a day. So most of the capsules are about 1 gram, and that puts people, when I measure their oils, and people that are taking the 1 gram a day generally get a pretty good balance of omega-3 to omega-6 to omega-9 in the lab studies that I do.
Okay. Aubrey says, what do you think about coconut oil and MCTs?
Okay. MCT means medium chain triglyceride, and it is a fraction, a part of a coconut oil. There are other oils that have MCT in it, but coconut oil has quite a bit of this medium chain triglyceride. What does that mean? Well, there's long chain triglycerides, which are between 18 and 22 carbons long. So all these, they have like 20 carbons attached to each other in this long chain. And that is a long chain fatty acid. And then there's the short chain fatty acids, which are 3, 4, 5. And then there's these medium chain triglycerides, which are in the 10, somewhere around 10 range. And what happens to MCTs, the way the body uses that is to make ketone bodies out of it. And ketone bodies are an energy source, a low octane fuel for the brain and for other parts of the body, and can prevent people from getting like Alzheimer's and stuff like that. So in that sense, MCT is a good thing, and that's okay. I think people overdo it though when they find something that's good and they say, "Ooh, more of that," and then they like overdo it. So they have bulletproof coffee, and they're putting butter and MCT oil and coconut oil and this thick layer of it, drinking it down every day. I don't know. I don't think there's any particular problem with that necessarily, but I would wonder if that doesn't create problems in the long run.
Interesting. All right.
Okay, the one problem I can think of right away is if you have insulin resistance, those oils will make you more insulin resistant. So, yeah.
What about avocado oil?
Yeah, all oils do that, even avocado oil. But avocado oil is pretty good for you. It doesn't have omegas in it, or it has very little. It has some, like 1% or 5%, but yeah.
Aubrey asked, is krill oil better than fish oil?
Krill oil is one of the ways fish get their oil. So yeah, krill oil is fine. It's as good. It's omega-3, and it's a precursor to some of the other ones. So it's not the same ratio of DHA to EPA, the different types of omega-3s. But yeah, it's great. And your body can take, whether it's from the fish or from the krill or from flax seeds. If you look at the amount, 1 tablespoon of flax seeds, I've been studying this, right? 1 tablespoon of flax seeds will give you 2 grams of omega-3 oils. It's not a arachidonic acid. Yeah, it is. Yeah. Anyway, yeah. So the AA, yeah. So the your body can use that to make the other ones, the DHA, the EPA. You don't actually have to eat those specifically.
Marcia said, my doctor gave me Meloxicam, 15 milligrams. Does this have bad side effects?
Well, look it up. There's a black box warning, and it's heart disease.
Hmm,
So generally that should not be given to people that have heart disease.
interesting. A couple different questions, because you said something that a lot of people are wondering about. Did you just say something about fish oils, or excuse me, or coconut oils possibly causing more insulin resistance?
Warning.
Yeah, well, all oils do that. Oil, when you take in fats are oils, right? Lipid, fat, oil. In the organic sense or in a human sense, because we're not eating like petroleum oil, so that's something that's not included in this conversation.
I mean,
So then
maybe
when
people
we're-
are, yeah.
So when we're talking about bodies and biological systems, then whether it's oil, fat, or lipids, it's all the same. And so when you take them in, the body, those increase insulin resistance for a period of time. And it's hours. It could be a whole day, depending on how much you take in. So think about it, like you eat a pizza, it's just like all the oil that's in the cheese of the pizza, or they drizzle avocado oil or olive oil on it. That can make you more insulin resistant for many hours afterward, even half a day. So coconut oil, all of those oils, they do that. And think about why that would be. It makes perfect sense. If you have a bunch of oil to burn, then you don't need sugar. You want to use the oil, and so that's a big problem if you think about insulin resistance, because this is a problem that happens with as you become more insulin resistant. Your insulin level goes up that tells that does not allow your body to burn fat for energy because it blocks that. And so then your triglycerides go up, and your triglycerides, those are oils, and they make you more insulin resistant. So they have this cycle that sets up that some people, I've had people with, man, their triglycerides are 1,000. Normal is 150. And so you draw their blood and you got this much blood, and then the fat floats to the top, you got the same amount of fat that you have blood. Kind of scary.
I did want to bring up, you mentioned flax seeds. So there is a recipe for that includes 2 tablespoons of flax seeds in the Healthy Heart webinar solution kit. It is for the pumpkin quinoa porridge, and you can get all of your omegas in one recipe. Check it out.
Get a lot of omegas.
That's gonna be really good for you. That
Awesome.
And it's fall coming up right around the corner. It's got pumpkin in it. Start now.
Yeah. That's good. Okay, Kelvin said, been on baby aspirin we have a lot of people on baby aspirin. This is good to know. Been on baby aspirin for over 10 years. About 5 years ago, reduced it to taking just 3 times a week. Monday, Wednesday, Friday. My cardiologist was not too happy with me, but my bruising and bleeding reduced dramatically.
Oh, thank you. Oh, see, this is why we do the webinar, because people come up with these things. That's a real thing, and that's a great thing to take it once or twice a week, 3 times a week. Yeah, and you can titrate the dose. Remember, I said it's a permanent inhibitor of that cyclooxygenase in the platelets. So if you take it, you don't have to take it every day. If you take a small dose, once or twice a week or whatever, like especially somebody who's getting bruising, and you go, I don't want to have bruising all the time. I don't want to be that thin. So you can adjust the dose and go, okay, this is the amount that it takes for me not to have bruising. And so, that's totally reasonable. I don't know why the cardiologist would be mad about that. I think that's a great idea. Maybe the cardiologist doesn't know that it's a permanent inhibitor that only as you're making new platelets are they going to be able to form clots and cause vascular problems.
Okay, Fred says, I'm in tune with my body and have never been able to take baby aspirin. Some cardiologists don't believe that, but the individual has to determine whether they want to deal with the stomach pain.
Exactly. See, that's key right there. Some people do not tolerate it at all. I have people that take a baby aspirin, they instantly get stomach problems because it does prevent the lining of the stomach that protects you from the acid, and so it definitely could be a problem.
Alma said they have had me on baby aspirin for years. I have hypertension, cholesterol is a little elevated, varicose veins, but never had a clot and no heart attack. Now having microscopic blood in urine, which is a new thing, and venous stasis on ankle. I'm concerned about the aspirin.
I'd say read that again.
Yeah, yeah, if you've never had clots and never had issues, being concerned about the aspirin, especially if you're seeing bruising or leaking of blood vessels or anything like that, yeah, the aspirin's a problem. But over time, if you've been taking it that long and you don't have stomach ulcers, then you probably don't react badly to it, and it's probably not going to cause that problem. So here's a really good person that could switch from a baby aspirin to a omega-3 supplement and add vitamin E.
What does the vitamin E do?
Vitamin E is an anti-inflammatory, but it also slows down the clotting mechanism. So it actually works in the clotting factors. And it here's the interesting thing about vitamin E. They did a study on vitamin E and they said, oh my gosh, people on the vitamin E got more heart disease. Well, one of the problems is they were taking a vitamin E called DL-alpha tocopherol, which is a chemical form of vitamin E. It's not a natural form of vitamin E at all. A natural form of vitamin E has no L-tocopherol, it's only D. And then it has tocotrienols, and it's not just alpha, it's alpha, beta, gamma, delta. And then, so this complex of what vitamin E is, if you eat almonds, for example, you're getting a complex of different things that help prevent clotting, vitamin E. Whereas if you take a chemical vitamin E, you're not getting that benefit. So, if your cardiologist says, "Oh, don't take vitamin E, that causes heart disease," just go, "Yeah, I know it causes heart disease. I'm not taking the one that causes heart disease."
Oh, interesting. Okay. Okay, so Ernest, or actually this is from Fred. Fred says, so using an air fryer, would that eliminate the oil creating insulin resistance?
Oh yeah, that you can eliminate a lot of oil by using an air fryer. Yeah, that's not a bad idea. An air fryer is just a convection oven, a toaster oven, convection oven combination. Yeah, that works great. So that you don't have to add oil to it, to like frying things. Good idea.
Marcia says, my husband has a 4.4 centimeter aortic aneurysm for over 8 years, and he has developed stage 3 chronic kidney disease because of the loss of blood flow to the kidneys. Because it has maintained this size, they don't want to do surgery for the aneurysm. He also takes a low-dose aspirin to keep his blood thin. Do you agree with that decision for no surgeries, risking more damage to the kidneys?
Gosh, well, I don't know why the kidneys would be damaged. Because in the aortic aneurysm, 4.4 greater than 4 is a large and an aneurysm, but if it's less than 5, it's not likely to rupture. So that's why they don't want to do surgery. And that makes sense because all the issues of repairing the aneurysm, it's not a panacea. It's not like, oh, now it's back to normal. It's not a normal thing. You have this Gore-Tex or whatever graft inside your aorta, and it's a foreign material, so it's going to cause problems all by itself. So yes, if you can avoid surgery, that's better. But I would look into why the kidneys are failing. I suspect that's not because of the aneurysm. that, looking at the renal arteries themselves, are there aneurysms or some other problem with the blood flow to the kidneys? Because often what happens if there's limited blood flow to the kidneys in some way, like a kink or an aneurysm or something, then what happens is the blood pressure will go up dramatically, and it's really hard to control that blood pressure because the kidneys are saying, hey, we need more blood flow, but the renal arteries are closed, so they're not getting blood flow. And then you take a medication to drop the blood pressure, they're getting less blood flow. So then it creates a cycle so find out why the kidneys are failing. Is that like, for example, people get insulin resistance and they don't have diabetes, but just because of the insulin resistance, their kidneys can fail. There's all kinds of inflammatory problems like lupus that can cause kidneys to fail. So I would suspect that unless the aneurysm is closing off the artery, in which case they should put a stent in. I don't know. Doesn't make sense to me.
Okay, these are good questions, guys. Cindy said, I have insulin resistance, type 2 diabetes, high cholesterol, high triglycerides, and I do not tolerate statins at all. I have always had elevated cholesterol and triglycerides all my life. So did my mom. What can I take to help the cholesterol? I don't eat fish and I'm on phase 1.
Oh, phase 1. Okay. So
I'm assuming are you on phase 1 of the diabetes solution kit?
That's my guess.
Yeah.
Okay. So the cholesterol by itself, the level of cholesterol is not related to heart disease, but there is a clue in there that there's a problem, and that is the triglycerides are elevated. And so there is something that should be done. And if you're in phase 1 and you're doing a very low carbohydrate diet, that's a great place to start, because that indicates that high triglycerides is an indication that you may have insulin resistance. And the fat in your arteries, in your blood, may contribute to the insulin resistance. And so avoiding eating high fat foods when you're on phase 1 means eating a lot of those free foods that we talk about, that you can have all the broccoli and spinach and lettuce and cauliflower and cabbage and Brussels sprouts, all that list of foods. Eat a lot of that stuff, and because a very high fiber diet with low fat, and in this case, detoxing low carb would be a great way to handle that kind of a problem.
A couple questions about these, just a reminder. So we've briefly talked about diabetes solution kit. We've talked about the healthy heart solution kit. Those can be found at bartonwebinar.com. And if you use code webinar25, you'll save 25%. Also want to mention that Cheryl posted a little code for 50% off of the Home Cures That Work subscription. So you're going to want to check that out. That code is Home Cures 50. And I did post that. Actually, she posted that on Facebook and I posted that in the chat. No, actually, I think we posted on both places. So check the chat. You'll find those codes. A couple more questions here. And then I know Dr. Saunders needs to get going. Alma said, what was the chemical form of vitamin E that you had mentioned to avoid?
Oh, DL-alpha tocopherol. Yeah, that's.
Let that roll off your tongue a couple times. All right. Eric says, Dr. Saunders, I'm insulin resistant. It's coming from fat, I believe. Is it best to use butter or olive oil in moderation?
Well, either way that you're going to get insulin resistance from either one of those. Olive oil, you need the omega-9s. Olive oil is a great oil, actually. It doesn't have any omega-6s that cause inflammation. It gives you omega-9s. So my preference would be olive oil. But some people buy that grass-fed butter. And the grass-fed butter is going to be omega-3 oils. And so there's some benefit to that too. So if you alternate, I don't know. It's not that one's better than the other. If it's insulin resistance, neither one of them.
Someone had said, let's see here. It's interesting. So the baby aspirin that is It's the baby aspirin that's causing the bruising. Sometimes I look like somebody took target shots at me, black and blue marks all over the place.
Yeah. And then if you go to the ER, they're gonna say, "Hey, who's been beating you up? Who's abusing you?" You know.
Yeah.
It's the baby aspirin.
Very interesting. Eric had said exercise works really good too, but Popeye also died.
That's true.
It's true.
That's true. All that spinach. Yeah. You're still gonna die.
That is funny. All right. This is great, guys. We got a lot of good questions. We have a bunch of our team that's on today on Facebook, and a few of them are on here too.
So the way I look at it is that, yeah, we're all going to die, but we don't have to decline. You know, our function doesn't have to go down and end up, you know, live the last 6 months of our lives in a nursing home. The idea is to be fully functional for your entire life, you know, and then when your life comes to an end, it comes to an end. But you know, why would you want to be like in pain with arthritis or with heart disease, or you're getting chest pain when you walk across the room, or, you know, whatever issues that you have to deal with? Gosh, if you have your health, you have everything. And you know, people have said that to me, and when I was young, I didn't really appreciate it. But as I'm aging, I'm going like, yeah, I really appreciate having my health. And I see people who don't, and I see people who, gosh, in Santa Barbara, we have people that have like a lot of money. They own businesses that, you know, these are like really wealthy people. And if they don't have their health, and I know some of them, they're not healthy. They can't walk across the room without getting chest pain. Gosh, it's hard to live. So no matter what else you have, your health is still like primary.
Yes. Amen. Well, thank you so much, Dr. Saunders. We so appreciate you again. Come back to us next week with even more information.
Yeah.
Deal.
And yeah, thank you. Enjoy the rest of your conference.
Okay, bye.
All right, guys, that's it for us today. We're so glad that you guys were able to join us, and all of you on the Barton team. I mean, it was a lot of pressure having all of you guys watch today, but
It was. Oh, no.
I think we're okay. They're like, we've known these guys for a long time. There's no pressure. Anyway, we will be back here next week, guys. So if you haven't registered for the diabetes type 2 webinar, you can do that at bartonwebinar.com. If you're on this webinar, you don't even know how you got here, register for it. It'll remind you about the webinar. You should get a reminder the day before and then an hour before. And these are free. So this is a really good opportunity for you to ask Dr. Saunders questions. I don't know many other places where you can do that. So it is a really, really unique opportunity that you want to make sure that you take advantage of, because we so appreciate it. And honestly, we don't know how long we're going to be able to do this, especially not for free. So get on, get healthy so you can live a good full life like Dr. Saunders was just sharing about.
If you found us on YouTube, go to Barton Webinar.
Yes.
You know, how many free webinars are there on our YouTube channel? 200 and something? Like, there's so much value, free value, that we love to provide to our customers. And soak it up, because not many other people do this for free with the doctor live. You can go to listen to podcasts, but you can't ask the doctor questions, not typically.
And he's doing, he's doing the research. He has people that come into his office who are dealing with these health issues. And so this is a daily thing. And we've mentioned this before, but Cheryl and I have traveled with Dr. Saunders, and he'll be like the weird guy that'll get up early in the morning and then come out when we're all out there for breakfast and be like, I've been up till 4 o'clock and I figured it out. I found out why one of my patients was sick. Like, he's doing hard, really digging into root causes. And I don't know that I can say that about everyone who is seeing patients. And I know there are great doctors out there and people who care, but he's one of them, and we just appreciate it. So hop on the webinars, tell a friend who might be interested. bartonwebinar.com is your hub. That's also the link to your YouTube channel so that you can subscribe so you'll never miss a webinar. So anyway, I think that's it for us. Yeah. You guys are awesome. Come back next week, and we look forward to hearing about your success. So be sure to share with us. We'll see ya. Thank you, Cheryl.
Bye.
Bye.